Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to Health Matters, a comprehensive chat by the Islamic Medical Association, your regular Tuesday night slot. And tonight we'll be discussing a very important topic relating to the skin, which I'll reveal just now. And our guest tonight is Dr. Irshad Ishaq, a dermatologist in private practice. Assalamu alaikum, Irshad. Welcome to the show.
Wa alaikum salam wa rahmatullahi wa barakatuh.
Alhamdulillah, alhamdulillah Rabbil Alameen, wal aqibatu lil muttaqeen, was salatu was salamu ala ashrafil mursaleen, Sayyidina Muhammadu wa alihi wa ashabihi ajma'een. We're discussing acne tonight, and obviously acne, most of you know, is a skin manifestation. But what we're seeing on the external sometimes has a basis on the internal. And from our Islamic basis, we are told to make wudu 5 times a day. And we are cleansing ourselves outside. And each time we're making wudu, the Prophet ﷺ has mentioned that we're washing away our sins. So with an external act, we are also cleansing ourselves internally. And wudu is one of the most important ibadahs. And let's not trivialize it, and let's make wudu properly before we start our salah every time. And it's also important that we make fresh wudu from time to time, because that in itself also cleanses us according to another tradition of the Prophet Nabi Sallallahu Alaihi Wasallam. Irshad, acne, a very common condition, and most people have come across acne within their family and their children, and sometimes the association is made that it's a children's disease. But we'll start off, maybe perhaps you can explain to us, what is acne?
Acne is an inflammatory disorder that occurs predominantly in the skin. There usually is no other association with any other organ system. And if you look at the skin itself, acne occurs out of the pilosebaceous unit. The pilosebaceous unit is referring to the hair follicle and its adjacent and associated sebaceous gland. These sit in the second layer of the skin predominantly.
So you want to explain some of those terms, what those glands are? Is it the sweat gland?
This is different from the sweat gland. Okay. The sweat gland is another appendage or another organ that's associated with the skin. But the sebaceous gland is the gland, put very simply, that produces oil for the skin, kind of a natural moisturizer for the skin. And that gland is intimately related to the hair follicle, which produces your hair.
Okay.
Now, even though there are certain areas on our body that produce hair, we've got hair follicles that are associated with sebaceous glands almost all over our bodies. And it is a disorder that occurs in that particular area of the skin.
Yeah. Okay, so this slide on the screen is explaining what you are talking about at the moment.
So if you look at the slide on the screen at the moment, we are referring to the hair follicle, which is item number 4, and we're looking at item number 5, which is the sebaceous gland, which is intimately related with the hair follicle. So looking at that picture in terms of acne, so what happens? How does these pimples, what people call pimples, come out? There are essentially few factors that result in acne. The first and most important problem in acne is where you have a slight abnormality or a blockage of the opening of the hair follicle. So where that hair shaft, the hair grows out of the skin, is where we have a slight blockage that occurs. That's the first and fundamental problem. In addition to that, you have that sebaceous gland, item number 5, which produces excess oil or sebum for the skin. In the normal setup, that sebaceous gland empties its contents next to the hair follicle, and that is supposed to make its way out to the top of the skin. But when you have that blockage at the top of the hair follicle, that oil is being produced but has got nowhere to go. That's the second problem. In addition to that, you then have bacteria, and specifically a bacteria called Propionibacterium acnes, that feeds off this excess oil that also results in an infective process. And then the fourth process that occurs is overall inflammation. So these 4 items put together results in a complete inflammation of that sebaceous gland, the adjacent hair follicle, and you end up with pimples. And depending on the degree of the inflammation, it could be subtle, such that you end up with whiteheads and blackheads. Otherwise, on the other end of the spectrum, you can have serious inflammatory acne that can result in scarring.
So you get different grades of acne.
You get different grades of acne, and the different grades of acne will dictate or determine what sort of level of treatment or what type of treatment you would actually choose for your patient.
Okay, so we'll come back to treatment a little bit later. How common is this condition?
Acne is extremely common. If you look at worldwide, almost 99% of people worldwide would be affected by acne. The difference between a person with acne and a patient with acne essentially boils down to patient tolerance of disease. And what I mean by that is you would find somebody who's got 1 or 2 acneiform lesions or pimples, and it really wouldn't bother them. They'd live through life without much of a problem. They wouldn't even seek medical help or go down to the local pharmacy and pick up a cleanser or a face wash. On the other side of the spectrum, you'd have somebody who's got seriously inflamed acne, and they would end up seeking assistance for it. But overall, acne is extremely common, irrespective of geographic location, race, color, nationality, and age group as well. Because if you look at the age groups of patients who are affected by acne, a decade or 2 ago, we had this mentality that acne was predominantly a disorder of teenagers and early adults. However, we're now begin to view acne more as a chronic disorder. So we see patients in their 5th, 6th decades who are still affected by acne to some extent. It may not be severe, but they still got acne that's rumbling along in the background. And you'll find that a lot of the patients will begin their acne as a teenager, but acne generally tends to run a chronic course. In fact, it is now regarded, according to the most recent acne treatment guidelines, as a chronic disorder.
Chronic is in the same category like diabetes, blood pressure, that it's there all the time, or does it go into a state where it's a little bit quiet, where you don't see the pimples and they erupt again, or you get different formations, different grades?
If you look at acne, if you look at diabetes and hypertension, they run a chronic course in the sense that they will usually be present, and you will find that patients will go through periods where they gain control, slightly out of control. If you compare that with acne, acne has a similar course that it runs, where you'll get patients who go through remissions and flares and remissions and flares. And you'll find that that's one criteria that has been used in order to classify acne now as a chronic disorder. The other reason why it's been classified as a chronic disorder is that the psychological impact of having acne is similar to having epilepsy or asthma. And there are studies to actually show that.
That's quite severe, that means. I mean, because with epilepsy and asthma, the psychological impact is something that's well known and documented. We want to touch on that to explain a little bit on the psychological impact?
There are a great deal of patients with acne who would suffer negative psychological impact. Poor self-esteem, poor self-confidence. They will have difficulty in social interactions. You'll find that a lot of the patients with acne as well, they'll tend to be a lot more recluse as time goes by. Once treatment starts and the acne improves, you'll find that they'll begin to improve in their social interaction as well.
So the slide is showing some aspects of the quality of life.
Yeah, they also have anxiety as well. There's a lot of association with depressed mood, and there's high unemployment rates as well.
What? Yeah. Okay. Yeah. So basically, in terms of the acne, we know for a fact that there's an age predilection. Starts in the youngers and goes to an older age. But in terms of gender, female versus male,
there's almost an equal predominance between male and female patients. No one essentially is spared.
Okay. We're going to come, obviously the treatment is a little different between the two, because obviously with the females we use oral contraceptive sometimes as a treatment option. So we'll take a break, an ad break, and then we'll come back inshallah. Assalamu alaikum. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back to Health Matters Comprehensive Chat. Tonight we're discussing acne with Dr. Irshad Ishak, dermatologist in private practice in Johannesburg. We started speaking about what causes acne, what the condition is, the different age groups, and it's not confined to children and young people only. Also, there's no major difference between the different genders, male and female. The lines will now be open for you to call in. Please do call in. The number will appear at the bottom of your screen. And today we also have a gift for a lucky caller, inshallah. So one lucky caller will get a prize with skin products worth 1,500 Rand, which has been sponsored by one of the pharmaceutical companies. And that caller will be identified by the producers. So inshallah, please do call in. Especially, you stand a good chance to win a gift tonight, inshallah. Irshad, so we're talking about acne, and there's obviously some common forms and the rarer forms. So there's acne vulgaris, and there's acne associated with, we've had on a gynae show here previously, PCOS, polycystic ovary syndrome, where acne is one of the manifestations. Are those the two, the one that you discussed earlier, and then the PCOS? Is there a difference? And obviously the PCOS is in females.
In the manifestation that I mentioned before, predominantly will relate to the acne vulgaris, the common type of acne. Remember that the common type of acne predominantly occurs on the face, but you can get truncal involvement, so upper chest, upper back. And then if you look at the more rarer forms of acne, you can get neonatal acne. So acne in a neonate or a young child, newborn up to about a month, 2 months of age. But that's predominantly because of circulating hormones from the mother that the baby's liver hasn't yet broken down.
Okay.
That generally tends to be transient, usually does not require any treatment, and it tends to pass on its own. But if you look at the nodular cystic type of acne, which is the more severe inflamed type of acne, it can be quite depressing to patients. It leads to lots of scarring, and the predominant type of lesion is more looking like mini abscesses. And if you look at this slide that we currently have on the screen, on the top left, you've got the very mild forms of acne, the so-called comedonal acne, or commonly known as the whitehead and blackhead type of acne. And as you're going across the screen from left to right, you will see that the top slide, the top row, the third picture from the left, you begin to see the more pustular type of acne. So we're moving now towards the moderate acne. And as you come down to the bottom row, the two slides on the right hand side, that's the more inflamed, severe types of acne, where you end up with these mini abscesses in some cases, and you also end up with severe scarring that can occur in those patients. And a lot of those patients who develop this type of acne tend not to only have facial involvement, they also have upper chest and back involvement to a similar degree as well.
So those severe forms, so we have a picture there of on the back of the neck, and on the upper back, quite a severe lesion on the face there. Those are the nodular ones.
This is the conglomerate or the nodular type of acne, and these presents predominantly with the cysts and nodules, and they are usually pus-filled.
Yes.
So a lot of patients will come to you giving you the history that they've been trying to squeeze them or express the contents. That actually results in more of the scarring and the inflammation in the long run. And then you end up having the more fulminant type of acne. This kind of borders on another condition called pyoderma faciale. And if you actually break that Latin down, it's a pus-filled dermis on the face. So these are the more severe forms of acne that you would see. And not to forget that in some cases you can have complete truncal involvement.
That's what we're seeing
on the back, for example, here.
Okay.
And you can get some patients who don't necessarily have facial involvement at all.
Okay.
And this borders more on the acne maligna or malignant type of acne. And in some cases, some of these patients require admission to a hospital, and they require quite strong medication to treat this, and that medication requires monitoring as well. So there are cases that infrequently, but we do need to admit the occasional patient with acne. So as common as it is, you're going to have the more trivial or milder forms of acne where some people, like I said, may not even seek medical help for, And then you've got the more severe forms of acne that may require admission and certain high-powered medication.
You mentioned the word malignant acne. I know when people hear malignant, they start thinking cancer and tumor.
The word malignant in this particular case means widespread, okay, or has spread to a large body surface. But acne in general is usually only confined to the skin. So in a way, yes, you are correct in suggesting that this may be a misnomer, but if I could classify that, or to simplify that, we'd rather want to call that a more fulminant form or a more aggressive form of acne. That'll probably be the easier term to understand.
We got a caller. Assalamu alaikum. Assalamu alaikum.
Hello, Dr. Isak.
Assalamu alaikum.
Are you speaking to Peter?
Yes.
I would just like to know, is there any alternative to Accutane?
Any alternative to Accutane?
Use a generic. And which generic would you use?
Okay, the drug that you're actually referring to, the chemical formulation is actually called isotretinoin. Roaccutane is a trade name. In this country,
which was the original
which
product.
is the originator, which was originally FDA approved in 1981.
Yeah.
In this country, Roaccutane is still available, and there are many other generics out there as well. But essentially, they all are the same chemical formulation, which is isotretinoin. So yes, there are other generics out there apart from the original, which is Roaccutane.
The brother was asking, is there any differences with the generic and the original?
There are subtle chemical differences. However, overall, when it comes to the use of the drug, its effects, its side effects, its monitoring protocol, and its dosing, essentially there are guidelines that are used for all types of isotretinoin. So, although there are differences out there are different brands out there, essentially you're going to expect the same experience on the drug.
Does it answer your question, brother?
Thank you so much, Dr. Isak. I appreciate your advice.
Jazakallah khair, thanks for the call. So the lines are open, please do call in, and as I've mentioned, a surprise gift from the pharmaceutical companies on acne products is due to one of you, and the producers will identify the caller, so please do call in. But also Dr. Isak is here to answer your calls on acne, a very common condition, and we're discussing the severe form. I want to move on to now approach to treatment and management. There are different modalities. The caller preempted something that we were going to talk about, is the Roaccutane. Yeah. Where would you start? And we have different patients that come to us at different grades and severities. How do you go about identifying what you would use, topical versus oral? Also, before you answer that, we have another caller. Assalamu alaikum.
Wa alaikum assalam.
Ji, brother.
I would like to know if you have too much chocolates, it will get acne.
Chocolates.
Yes.
Ji.
Okay, there's been a lot of controversy regarding diet and the use of chocolates in particular, and also the excessive use of caffeine in some cases. There has been a few medical trials that have been done. However, in terms of the reliability of the trials, there hasn't been any conclusive data out there to suggest that an inclusion diet, in other words, adding something to your diet, or an exclusion diet, in other words, taking something out of your diet, may have any particular benefits in the course of your particular acne.
Yeah, but with the chocolate, it's quite a common thing that patients do ask. Is there a link in association? So your answer is not proven.
Not a direct association between the two. However, there are lots of anecdotes and stories of patients telling you, when I consume, for argument's sake, excess of peanuts or excess of chocolates, I tend to have a breakout. But there's been very weak medical trials to actually show a strong association.
Does it answer your question, brother?
Yes,
Jazakallah khair. Jazakallah for calling. So we're coming to modalities of treatment. So there's cleansers, there's topical applications, there's hormonal, there's tablets. How would you approach and how do you select
my patients?
Yes.
In the same way as I mentioned earlier, acne being a chronic disorder, you are going to get complications as well of any disease. So in the same way as you would approach a diabetic or a hypertensive, you're going to treat the active disease.
Sorry, I should interrupt you. We have a caller. Assalamu alaikum.
Walaikum salam. You're speaking to Shanaz, and I want to find out about Orathane. My son's been taking it for the last 6 months, but his face hasn't cleared up. It's actually more inflamed.
Shanaz, what dose is he taking?
What?
What dose? Is it 20 milligrams, 40
20 milligrams, 20 milligrams.
Once a day?
Yes, once a day.
Dr. Ishaq?
Okay. Orathane is a generic form of isotretinoin. The important thing here is that the use of isotretinoin, especially if it's used in high doses, is not, in my opinion, a duration-dependent drug. The drug basically is given as a cumulative dose. The benefits of using the drug is in using enough of the drug to be able to shrink that sebaceous gland that's producing the excess oil in the long run. One of the expected side effects of isotretinoin, irrespective of whether you're using an original or a generic, you can end up having a deterioration or a flare in about 20% of patients. Usually that flare occurs somewhere between around week 2 of commencing treatment, and I've seen flares as late as lingering on till about week 10. If your son's basically already been on the medication for the past 6 months, I think it is important to work out from his entire total intended course, how far has the patient gone already? Because you can add other drugs on board with the isotretinoin that can reduce the extent of the inflammation. Those drugs may be brought on temporarily, because you must remember that the more inflammation you are incurring, you are going to have a poorer texture to the skin at the end of the treatment. So more scarring, more complications. So if he hasn't settled after 6 months on treatment, I wouldn't panic. I would have the prescriber to take a look at him and reassess the situation, perhaps add another drug on board to reduce the inflammation and relook at the doses.
And what is the other drug that you recommend that goes with it?
One of the other additional drugs that can be used are cortisones or oral steroids. They can be used in conjunction with isotretinoin to reduce the extent of the inflammation. But like I said, I think whoever's prescribing it needs to relook at that particular case and maybe modify the treatment regime.
Shanaz, is he using anything topically?
No, he doesn't put any cream on his face. His skin is very oily.
So would you recommend that he use some kind of cleanser or something?
I think in terms of the daily skincare regime, non-prescription items, a simple non-foaming cleanser is what he should be using twice a day. And obviously with a drug like isotretinoin, one of the commonest side effects is going to be related to dryness. So he's going to have dryness. You must remember that the oil concept on the skin is not the same as the hydration or water concept on the skin. Your skin can be oily, yet your skin can be dry. Roaccutane or Orathane or isotretinoin, because it reduces the amount of oil that the gland produces in the long run, it may make your skin more fragile, but your skin can also be dry. So you need to have a good quality moisturizer that you would apply onto the skin after you've cleansed.
Jazakallah for your call, Shanaz. I hope that will help, inshallah.
Thank you very much, it does.
Assalamu alaikum. We have another caller.
Yes, assalamu alaikum.
Wa alaikum salam.
Yes, doctor. I just want to find out from the doctor. I'm a diabetic person, an elderly person, but I've got lots of itches on my body every day. What's the cause of that? I will be on the list.
Okay, an itchy skin in a diabetic can be as a result of many things. Firstly, you can get something called diabetic sensory neuropathy, where as a complication of poorly controlled diabetes, you can have an excessive or a exaggerated sensation to normal stimuli and sensation. So itch is one of those things that can occur in a diabetic. The other thing that can occur is that in diabetics, their skins tend to be a little bit drier than usual. And as diabetic patients tend to get older, the quality and the amount of natural moisturizer that you produce also begins to change, thus resulting in an itchy skin. Dryness will drive itch. You can get a condition as well called Williams itch. that is associated with diabetes as well. And in that particular case, one of the starting places of treatment is going to be good quality moisturizers on a daily basis.
In addition to good control and all the other things you have to do with the diabetes. Diabetes is a whole system disease. Today is World Diabetes Day. So in fact, we also want to urge people that please do try and control your sugars and meet your targets. Skin is one of the complications, and there can be severe skin complications which can make quality of life very, very difficult and impaired. Inshallah, we will be back after the ad break. Assalamu alaikum. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back to Health Matters Comprehensive Chat from the Islamic Medical Association. We're discussing acne with Dr. Irshad Ishaq, a private dermatologist in private practice in Johannesburg. We've had quite a few calls from you. Please do call in. We have a gift for you for one caller, inshallah, and will be identified by the producers. The gift is worth 1,500 Rand from one of the pharmaceutical companies. So do call in. And besides the gift, Dr. Ishaq is here to answer your questions on acne. We've had some very good questions, so please do call. We were discussing the management, treatment, and there's quite a few elements to the treatment. There's oral tablets, there's homeopathic treatment, there's cleansers, toners. How do you approach? What do they do?
When it comes to my patients, like I was explaining earlier, with any chronic disorder, you've got the disorder itself and you've got the complications thereof. So I tend to...
Sorry, Maf, we're having good calls today, alhamdulillah. Assalamu alaikum. Ji brother, go ahead with your question.
Okay. About the steam room, sauna and hot showers. Can that have an adverse effect or beneficial effect on acne, psoriasis, and eczema?
So the question is relating to acne, psoriasis, eczema, and going into a steam shower and sauna. Is that right, brother?
Yes, that's right.
Okay, jazakallah.
Okay, let's take the steam scenario in the context of acne first.
Right.
If you look at the general warmth and the moisture from the steam, that may contribute to a small extent in the division and the multiplication of the bacteria that actually cause the acne. However, that may not necessarily be a primary driver of acne. So it will have a relatively minimal effect.
So you're saying it may make it worse?
It may make it worse, but not to a large extent.
Okay.
However, if you look at the environment in a sauna or a steam bath or a jacuzzi or a hot tub, there are certain disorders that are usually yeast or fungal based that can result in a folliculitis, where you have a yeast infection that occurs in the hair follicle itself. And that can mimic acne in the way it presents. And a lot of times patients are basically mistreated as acne patients when they've actually got themselves a yeast folliculitis. So the distinction there needs to be made. And it could be gyms, saunas, it could be a private sauna, it could be a hot tub, a jacuzzi. Those are all the risk factors for the development of that particular type of folliculitis. If you're looking at eczema and psoriasis, the moisture or the warmth may exacerbate the problem only because the warmth and the heat results in excess blood flow through the skin. But the actual steam itself is not expected to significantly worsen your eczema or your psoriasis. In fact, in some cases, we actually ask patients to bath in warm baths, and especially if they add things like salt to the water, they tend to assist in the hydration of the skin. So the steam baths not necessarily are going to worsen your psoriasis or your eczema.
And it may or may not help.
And it may or may not help. The most important thing is that after that hot shower or after a steam bath, you must remember that because the temperature of the skin has now been increased, your evaporation of water from the skin is at its peak in the first 3 to 5 minutes thereafter. So if you are taking such warm baths or such hot showers in some cases, which some patients claim to improve the itch or provide relief from the itch, you have to be able to apply a good quality moisturizer immediately after you pat yourself dry with the towel, because you want to trap that water in the skin before it begins to evaporate and thereby you'll be able to hydrate the skin a lot better.
Jazakallah khair for that. I hope that answers your question, brother. So we're talking about treatment and your treatment modalities and your approach.
So I was saying that what I do is I basically tackle the complications of the disease after I've settled down the active acne. The treatment options for acne vary depending upon the grade or the staging of the acne, and I think that's very, very important at a practitioner level, that you recognize the degree of involvement or how severe is this acne, because that dictates which treatment option you're gonna use. Beginning with your topicals, items that you would apply on your face, prescription items, there are various items that can be used. Most commonly there are items that contain benzyl peroxide at various concentrations, anywhere between 2 to about 6%. They can be used either on a daily or a twice daily basis. Then you can look at vitamin A drugs or the retinoids. They are available also in ointments and cream forms. They can be applied onto the face. Generally, we prefer to use these at night because you can get a little bit of sensitivity in the sunlight from a vitamin A drug. The new guidelines, or the most recent guidelines, indicate that it is beneficial to combine topical treatments. So you'd probably use something like a benzyl peroxide in the morning and a vitamin A-like drug in the evening.
Do the benzyl peroxides make the skin too dry? Because some of the patients do come back and then they find that it has made them dry, so they actually give up using it instead of modifying the use.
Irritation is a well-documented side effect of the benzyl peroxides, and they are also a side effect of the retinoids. But the key to their use is that you need to use a small half a pea to a pea size amount on your entire face. That's all that you require. A non-foaming facial wash, which won't assist with drying the skin, and then a good quality moisturizer to be applied after your prescription item, in order to keep the skin moisturized, because that reduces the risk of the irritation. Majority of patients who use a benzyl peroxide or a vitamin A drug in its applied form, by week 2 or week 3, they tend to settle down and they begin to tolerate the medication quite well. If the patient is informed about this at the time that they are prescribed the drugs, majority of them are tolerant of the side effect. The other trick to it is that you could prime the skin. So in other words, probably use the benzyl peroxide for about 2 mornings in a week. By the next week, you increase the frequency to 3 mornings in a week, and only by week 3 or week 4 do you get the benzyl peroxide going on a daily basis.
So you upscale it over a period of a month and start with a very minimal quantity.
Quantities, correct.
The use of topical antibiotics. So you got topical antibiotics, oral antibiotics, and most people seem to go straight for oral antibiotics from day one, but you can explain that. But let's start with the topical antibiotics.
Topical antibiotics would be another form of topically applied items. Topical antibiotics are generally frowned upon if they are used as a single therapy. And the reason being is that you do develop bacterial resistance. So in you trying to target the Propionibacterium acnes, you end up getting resistance to the antibiotic. And also bear in mind that I mentioned that acne is a chronic disorder. So sometimes you require these antibiotics topically for long periods of time. So your risk of development of resistance also increases. There are combinations available with a topical antibiotic and a benzyl peroxide. However, the studies have shown that a topical retinoid together with a benzyl peroxide, that combination is superior than benzyl peroxide and a topical antibiotic.
So would you say that topical antibiotics should be used sparingly at times needed, or for very mild acne to target 1 or 2 lesions?
There are some topical antibiotics that can be used, and the main context that you would consider using them would be a patient who is super sensitive to using a retinoid or a benzyl peroxide, where you kind of being painted into a corner to use something. The other context will be pregnancy, because you wouldn't want to use a retinoid in any form in a pregnancy situation. In that particular case, again, a topical antibiotic would be an option, but again, you would want to use that in combination with the benzyl peroxide to reduce the risk of resistance.
Please do call in, Dr. Ishad Ishaq. We're discussing acne, and we're waiting for your calls. The number is at the bottom of your screen. We also have a gift for one caller, so we're waiting to give that gift to somebody. So waiting for the calls. Ishad, so people also tend to go to the pharmacies that use over-the-counter products. Now, I don't have any issues with that, but obviously sometimes what happens then, patients come to the practitioner, to yourself, to the doctor, and they've been using like 6, 7, 8, 9 products from one pharmacy, and then from a cosmetic shop, and from a doctor they're using an antibiotic. How do you sift through all of this?
The patient actually comes to your practice with and opens up a carrier bag with 10 or 12 items is not unusual. What that tells me is the level of desperation of the patient. And that also gives you an idea of what the psychological impact of the disease is.
Right.
They would do anything that anyone tells them that's going to make their skin better.
Yeah.
And you don't blame the patient.
Of course.
The important thing is to actually guide the patient into simplifying things. Firstly, whatever modality of prescription items you want to use, that'll become the core for your treatment. In terms of sifting out from the over-the-counter items, a general or a simple cleanser is what they would need twice a day. They need a very good quality moisturizer, and they would need a good quality sunscreen. If you're using items like isotretinoin, benzyl peroxide, vitamin A-like drugs, which are all going to exacerbate dryness, you probably want to stay away from things like toners. Especially, there are toners out there that don't contain alcohol, but there are those that contain alcohol that will further dry the skin, therefore making the skin a lot more irritant, and therefore compromising the compliance of the treatment regime. So you want to remove those as far as possible. And I tell the patients that you want to keep this as simple as possible, because the simpler the regime, the better the compliance in the long run. And if you look at teenagers, high school, grade 10, 11, 12, with studies, you'll find that you don't want to give them a complicated regime that they can't remember, or that's going to take up half their morning and half their evening, and it becomes a burden for them to actually take care of themselves. So I basically use a cleanser, a moisturizer, and a sunscreen.
Jazakallah khair. Caller, assalamu alaikum.
Hello.
Hello, assalamu alaikum. Go ahead with your question, sister.
Assalamu alaikum.
Wa alaikum
My
salam.
name is Sumaya Gatu. I'm phoning from Kelvin.
Ji.
I'd like to ask the doctor about acne on the upper arm. What is the cause of that?
Acne on the upper arm.
Okay.
Jazakallah, Sumaya.
You can get acne that occurs on the upper part of the shoulder and the outer arm as well. Usually that occurs in patients who've got more truncal involvement. So those would have chest involvement, upper back involvement. That can be acne. However, in a lot of cases you have another disorder called keratosis pilaris. Keratosis pilaris is not the same as acne, but the way it forms is similar to acne in some aspects. You remember at the beginning of the show I mentioned that you have this abnormal blockage of the hair follicle that results in the pustule or the pimple that develops. In keratosis pilaris, you actually have a protein that plugs the top of the hair follicle, but not necessarily with the excess oil production and the infection from the bacteria that goes with it. Keratosis pilaris can also be associated with patients who've got impaired glucose tolerance. So a fair amount of patients may have pre-diabetes or diabetes, and there is also an association with obesity as well. So keratosis pilaris may appear like acne, especially the milder forms of acne, but it can be a standalone entity as well. So the distinction there has to be made, because you can use as much antibiotics as you want,
Not going to work.
not going to work.
So for the sister, I mean, she must first identify with her doctor whether it's keratosis pilaris versus acne. And then the treatment and the management is different.
Would vary slightly.
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 So the
You-
antibiotics will go out.
Antibiotics won't be of any value there. Your hormonal treatment like oral contraceptive pills won't work there either.
Okay, all right.
You probably use things like benzyl peroxide, glycolic acids, salicylic acids are things that are going to be used to dissolve that little plug, so you don't end up getting that sandpapery or that spiny appearance of the skin.
Does it answer your question, inshallah? I hope, and please do go. Okay, inshallah. So coming back to your treatment, and you're talking about
The oral treatments.
Oh, yeah, we got another caller. Assalamu alaikum. Ji, brother, go ahead with your question.
Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam wa rahmatullah.
Okay. Yakubai,
Ji,
this is the eczema related, not acne.
Okay, go ahead.
go ahead with your question.
Okay, my daughter who's got very severe acne, eczema, it's behind the tooth, on the arm, on the upper lip, and the head which gets very severe. We do go through the water, we have been using Percival, and we try and keep it moist. We don't know what can we put. Then she's a young girl and she doesn't like, it. So we want to get rid of it.
You got the question, Ishad?
Okay, it seems like
Jazakallah, brother.
it seems like this particular patient is suffering from a condition called atopic eczema. In atopic eczema, the predominant areas that are involved are usually behind the knees, the area in front of the elbow. You can get involvement mainly of the other flexures, like in the neck area, behind the ears. You can also get facial involvement as well. One of the fundamental problems in atopic eczema is that patients have a poor ability to bind down and hold on to water in their skin. So moisturizers here are exceptionally important in the foundation of treatment. The other associations can be with asthma, hay fever, runny nose, itchy eyes, sinus problems are all associated with this type of eczema as well. Now, you need to use, for example, non-foaming soaps or soap substitutes. No bubble baths. If it has bubbles, it generally has got a detergent action. It will help to dry the skin even further. And then, like I mentioned earlier about drying your skin, when you come immediately out of the bath is going to be the time for you to apply the moisturizers. That's going to become the foundation. At the time of a flare, there is the role usually for your steroids or your cortisones. Use at the time of a flare to settle the flare and the inflammation.
And is this now oral or topical?
They can be topical, but depending on severity, we may even use oral cortisones
So
for
it's a
them as well.
combination.
If the skin's been broken and the skin becomes weepy and you're ending up having a discharge out of that area where her pajama pants is being stuck onto the back of the knee, there may be indications of a secondary superimposed infection. That may require antibiotics. Other options for treatment is that you can use non-cortisone creams like the topical calcineurin inhibitors. There are some of them available and they are applied onto the skin as well. They also help to reduce inflammation, but they are of little value at the time of a flare. You would use that mainly as maintenance. There are other higher powered medication that's available that would fall into the, for lack of a better term, the chemotherapy class, but they would be, you need to be under the guidance of a dermatologist. You can also use things like ultraviolet B therapy for patients, where they would stand in an ultraviolet B unit and you'd expose them to ultraviolet B light, and that will help to suppress the inflammation using light rather than using tablets for them. And you can use these in many combinations. With regards to whether she's going to outgrow this or whether she's going to be cured, generally atopic eczema tends to be another chronic disease. Again, you'll go through periods of flares and exacerbations, and you go through periods where patients are well controlled for long periods of time. But the foundation of treatment is usually going to be your moisturizers and your soap substitutes. That is where you should actually concentrate on at the very beginning, and then you build on that pyramid of treatment going forward.
Jazakallah for that very comprehensive answer. I hope that assists you. Inshallah, we'll take an ad break, and when we come back, we will also identify the winner of our prize. So we will see you shortly. Assalamu alaikum. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back to our last segment of our show on acne. We have Abid Khan on the line. Assalamu alaikum, brother. Abed, congratulations, mashallah. You've been the winner of our prize today, as you can see it on the screen. And may you enjoy the hamper and your daughter. And this is the lovely gift that your daughter will be able to use. Obviously, just get some guidance from your doctor as to which products you can use. There's a combination. And congratulations to you, and jazakallah khair, and mashallah. Assalamu alaikum. You're welcome, brother. Okay. So we're reaching the end of the program. We've got a few minutes left. We've had so much to talk about, still complications and so many other treatment modalities and newer things like laser and micro peeling and micro needling. Contraceptives, I think we must perhaps just talk about that quickly.
Contraceptives will be another option for oral treatment, obviously only in female patients. They do have tremendous advantages because part of that excess oil production is driven by certain hormones. And by bringing the contraceptives on board, you tend to readjust the hormonal balance to reduce the amount of oil production. You usually find that also in patients who's got polycystic ovarian syndrome, where you can also use those particular contraceptives. But I like to refer to them as hormonal treatments, even though they may be classed or registered as contraceptives, because there's the stigma attached to the use of contraceptives in some patients. So it's important to understand that they can be a very helpful adjunct or additional therapy which you can use in combination with the topicals, and you can even combine those with the oral antibiotics and or oral isotretinoin as well. So just depending on the individual patient's circumstances, especially those who've got menstrual irregularities, you probably want to consider a contraceptive a little bit higher up on your list than an oral antibiotic.
Which will be addressing multiple issues at the same time.
Absolutely.
We've reached the end of the program. Time goes so quickly, inshallah. We hope to have you back again to discuss other issues. Do you have a quick 5-second take-home message?
I think when it comes to acne, it shouldn't be a disorder that is trivialized. I think patients should actually, if they are in doubt, seek the assistance of a GP or a dermatologist. And in terms of your home-based regime, keep it absolutely simple. A simple cleanser, a moisturizer, and a sunscreen with your prescription items is going to be more than adequate to keep you in good state through your treatment program. And then we can look at what complications we are left with, and then whether we're going to be using laser or chemical peels or microneedling, we can thereafter address the complications thereafter. But keep your home-based care absolutely simple.
Jazakallah khair for the valuable advice, and also congratulations to our winner of the prize, Awad Khan, and also to all the callers. We hope to be back next week with another show, inshallah, on Health Matters on Tuesday night. And also don't forget to all the diabetic patients out there, do look after yourself. The sugar control is very, very important. Today is World Diabetic Day. Assalamu alaikum wa rahmatullahi wa barakatuh.